Hello again, everyone. Welcome to class. Quick little look at personality disorders. In chapter 9 of our textbook, we are going through our class. We're just about over halfway through our textbook. So here we go. Let me share our PowerPoint here. Personality disorder. So there's a lot here. There's no way I'm going to be able to do this justice in a little overview of our video. So, and personality disorders is a very interesting and lots of good material in our textbook. And I suggested if you find a personality disorder that you're curious about or you want to know more about, go ahead and do a deeper dive into it. So the personality disorders come in what they call clusters, A, B, and C. Cluster A is this odd or eccentric personality disorders. B is dramatic or emotional disorders. And C is anxious or fearful disorders. And so we have these different personalities, and just in kind of review, personality is a group of characteristics that we all have, kind of character traits that we use throughout a lot of different situations, and it persists over time. So it's something that just doesn't happen in one particular situation or one particular time, but something that we normally have. And probably the most common personality characteristic trait is being introverted or extroverted. And we probably know which one of those we are. Some of us are a little of both, but that's what we're talking about as far as review. So the Big Five personality factor is a inventory that a theory of personality that came up with these different areas or sub areas of personality. They have, if you're interested in this, the textbook goes a little bit deeper. And of course you can take an online Big Five inventory or any of the other ones that there's lots of different personality disorder. Personality inventories, not disorder, personality disorder. So to get to the level of a personality disorder, we have to have these patterns of thinking or feeling that interfere with the individual's ability to function in the world and relate to others. In other words, their traits are impinging on their ability to go to school or go to work or have relationships. Oftentimes, this is apparent in early adulthood. Again, our personalities are not that fixed until adolescence and then early adulthood. All right, we talked about the different ones. Again, in that odd cluster A, we have paranoid personality disorder, where we really feel like people are out to get us, thinking about us, listening to us when they probably aren't. Lots of different reads. Schizoid personality disorder. Again, I'm just going to go through these and not going to spend a lot of time of them. Schizotypical, again, the odd or eccentric personality disorders. On to cluster B. These are the ones that are kind of dramatic or emotional. These are where we find borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder, and antisocial personality disorder. All real popular antisocial personality disorder is the old psychopath, the serial killer kind of thing, or CEO or politician that has no conscience in them. Let's keep going here. DBT, dialectical behavioral therapy, is probably the most commonly used talk treatment for personality disorders. It is a combination of changing behaviors and changing thoughts, and kind of a lot of techniques and that help individuals modulate their emotions and modulate their behaviors. So it's kind of one of the best ones, at least right now, that we have to help people who have personality disorders. Histrionic personality disorder. These are people who are using a lot of attention-seeking behaviors. They're often inappropriate in their need for attention, and very oftentimes desperate. Narcissistic personality disorder. These are the people that think that they're better than everyone else, and that everyone else is here to serve me because I am so wonderful. And you may have know someone like this or have dated someone like this. They are very charismatic, and in the beginning can be very interesting people. But after a while, they tend to use the people around them to get what they want, and then leave them behind. Well, let's see here. So cluster C, anxious and fearful personality disorders. So this is the avoidant personality disorder, dependent personality disorder, and the obsessive compulsive personality disorder. So let's talk a little bit about the dependent personality. This is where a person is really dependent upon another person for every decision they need to make. They are texting you to decide what shoes to wear, what outfit to wear today, when should I go, when should I come home, all of these different things. And really, they're not okay. They're highly anxious if they can't be in touch with the person that they're dependent upon. They have a lot of separation anxiety disorder kind of symptoms. So when they're separated from their person, they don't do that well. Let's keep going. So the obsessive compulsive personality disorder is that oftentimes the old type A personality characteristics. They're workaholics, they highly productive, they have a lot of perfection in their life. They want everything to be perfectly lined up. All of that obsessions and compulsions that they are living with is part of their personality. And it is their main traits, I guess would be the thing. They rigidly follow rules and schedules, and oftentimes will have trouble if you don't. Let's keep going here. I think we're doing pretty good here. I know I'm skipping a lot of things, and I'm trying to keep these shorter because some people are thinking they're too long, and some people want them to be longer. And my emphasis here is to really just pique your curiosity so that you can go into the textbook, read the chapter, and maybe do your own research. Again, thank you for joining me for personality disorders. A lot in this chapter, so enjoy. Bye for now.